Good morning, everyone. My name is Haley Aka. I'm an Associate Vice President with the Health Policy Institute of Ohio. Thank you so much for joining us this morning for our forum on criminal justice and health, keeping families together through criminal justice reform. HPIO is an independent and nonpartisan organization. Our mission is to advance evidence-informed policies that improve health, achieve equity, and lead to sustainable healthcare spending in Ohio. I want to thank our core funders who advance our mission with their steadfast investments in our work. And although this forum is taking place in early 2022, it's actually the last event in our 2021 forum series. So I want to thank our 2021 forum sponsors for their generous support of our online forums. We look forward to recognizing the organizations who supported our 2022 forum series at our first 2022 event, which will be announced soon. So be sure to sign up for our mailing list at hpio.net so you can receive announcements about our events, publication releases, news updates, all of those good things. We encourage you to tweet throughout today's webinar using the hashtag HPIO forum. We love interacting with you all over there. And you can find the slides and additional materials for today's forum on our events page. You can get there using this link, or you could go to hpio.net and click the events tab. If you have questions for our presenters today, please feel free to type those into the Q&A box here on Zoom. We'll be reading those aloud as time permits. Our President, Amy Rolling McGee, will be asking some of those questions aloud for our speakers. We'll also be responding to those questions in the question box as they appear. Okay, with the housekeeping out of the way, thank you all again so much for joining us for our discussion of the connections between criminal justice and health and the impacts of the criminal justice system on children and families. HPIO continues to explore this relationship between the important factors here that you see in our series of briefs on criminal justice and health. We look forward to learning alongside of you all today on this slice of the topic. We became interested in these connections because we know that our social, economic, and physical environment have major impact on our health. These environments include things like our housing, our educational and employment opportunities, the supportive connections that we have with family and community. But it also includes any experience we might have with the criminal justice system. And for justice-involved people, all of their environments, their clinical care access and quality, their ability to engage in healthy behaviors, all of the things we see on our screen here are dictated by the criminal justice system. And in Ohio, our justice-involved population is significant. The US has the highest incarceration rate in the world, and Ohio has a higher incarceration rate than most other states. In 2019, Ohio ranked 39th in adult imprisonment with 430 adults per 100,000 serving sentences in state or federal prisons. High incarceration rates, though, are a national trend and increased rapidly in recent decades, starting with a bipartisan move towards tough on crime policymaking in the 1960s. These policies that created this expansion, things like drug control policies, the money bail system, these were promoted as ways to deter crime and improve public safety, right? But what these policies do in practice is incarcerate more people. While jail and prison sentences do prevent incarcerated people from committing crimes while they're incarcerated, we know that the threat of incarceration does not prevent crime, and having been incarcerated does not deter future crime. So instead of contributing to community safety in a really meaningful way, what mass incarceration has done is lead to systematically disadvantaging many Ohioans, their families, and their communities. This is particularly true for the people we know are incarcerated most often, which include people of color, people with low incomes, and people with mental health and substance use disorders. This framework summarizes the many connections that we see between criminal justice and health. includes racism and community conditions as foundational factors that impact both experiences. And by way of introduction today, we'll walk through this framework really briefly. We see that health, particularly substance use and mental health, impact criminal justice outcomes like arrest and incarceration. So for example, nearly 2/3 of people who are incarcerated in local jails are also struggling with substance use disorder, which we know in part is due to the increase in drug-related arrests that we've seen over the last several decades. We also see that involvement in the criminal justice system can exacerbate health conditions like infectious diseases, chronic diseases, mental health and addiction challenges. So for example, behavioral health conditions like depression can be caused or triggered by the violence and isolation that occur inside prison and jail. And conditions like overcrowding can lead to the spread of infectious diseases like hepatitis C and COVID-19. Finally, we see that racism and community conditions like childhood trauma and threats to family well-being are foundational drivers of both criminal justice and health outcomes. We know first that racism has an impact on our health. On the left here, we see that young people of color are much more likely to be treated unfairly due to their race or ethnicity. And on the right, that these experiences of racism lead to physical and emotional symptoms later in life. It has an impact on our health. There are also large disparities in incarceration by race. Nationally and in Ohio, Black Americans are incarcerated in state prisons at more than 5 times the rate of white Americans. We see a similar pattern for arrests. Now, the reasons for these racial and ethnic disparities are not due to any difference in behavior, but are instead historic and systemic. To learn more about that, we invite you to look to our criminal justice and health brief that focuses on justice and race. I know my colleague Stephen just dropped a link to that brief in the chat. We invite you to learn more about that if you haven't seen that already. Another driver of poor health and criminal justice involvement that's particularly relevant to today's conversation is exposure to trauma and the impact of that trauma on families. Adverse childhood experiences are these traumatic events that occur during childhood. And you see here, these are things like abuse, household challenges, and neglect. And several of these ACEs are directly related to having a parent involved in the criminal justice system. Experiencing adversity as a child can have both immediate impacts on health and long-term impacts on health, things like depression, learning disabilities, ADHD, anxiety. But involvement in the criminal justice system itself is a traumatic experience for individuals and their families. Things like negative encounters with law enforcement, separation from family and community, disciplinary practices like solitary confinement. These are traumatic experiences for justice-involved people impacting their health. Not only that, but experiences of incarceration of a parent then destabilizes families, exposes children to trauma, increasing the likelihood that the next generation will be incarcerated in the future. Despite the many challenges that we see at the intersection of criminal justice and health, and there are many of them, we know that improvement is possible. There are evidence-based policy solutions to combat the drivers of criminal justice involvement and poor health and well-being outcomes for children and families. And we look forward to hearing from our speakers today about some of those solutions. But before we get to solutions, our first speaker today is going to lay out some of the impacts of incarceration on children and families. Dr. Samantha Bach is an assistant professor at the University of Cincinnati College of Nursing, and her research focuses on understanding and mitigating the consequences of mass incarceration on child health. So we're so thankful that she's with us today. Thank you. Thank you, Dr. Bach.
Thank you for that welcome. I'll go ahead and screen share. And thank you for that warm welcome. And thank you for taking time to listen to this talk today. There is a lot going on in the world today, and it feels really heavy. So my hope is that I am able to keep your attention and share some science and some stories today. First, I would like to acknowledge the sensitive nature of the content. And while there are multiple viewpoints about incarceration and punishment, this presentation will primarily explore the effects of mass incarceration on children whose parents are incarcerated. I also would like to acknowledge that I have no conflicts of interest and give thanks to the many mentors and collaborators and the students who have assisted on a couple of their research projects that I will be sharing later. In addition, none of this work would have been possible without internal and external funding. I start with this picture as it reminds me of the times that I would walk past visitation areas during my time as a nurse in prisons. I would walk past security fences and a crowded visitation space where small children would visit their parent. This picture also reminds me of the time I had a conversation with an incarcerated mother who disclosed to me that a physician told her caregiver and her children that they shouldn't visit her in prison. Those experiences and many more spent inside and through reflection have really shifted my ideas about the social determinants of health and the social determinants of crime and the relationships between both justice and health that Haley just remarkably laid out. After working inside as a staff nurse and completing my PhD, I went on to deepen my training and research at the Nationwide Children's Hospital Center of Child Health Equity and Outcomes Research. This led me to my current position as an assistant professor at the University of Cincinnati and the College of Nursing and affiliate faculty of Cincinnati Children's Hospital Medical Center. A newer report using data from a sample of 4,000 people generated the latest estimates that we have on the percentage of American adults that have ever experienced family incarceration. Their findings indicate that nearly half of all US adults have had an immediate family member spend some time in jail or prison throughout their life. And they estimate that 1 in every 4 has had a sibling incarcerated. And they also estimate that 1 in every 5 adults have had a parent incarcerated. And using data from larger child samples, others have estimated that nearly 1 in every 14 youth have had a parent incarcerated. Unfortunately, due to vast racial and ethnic disparities in sentencing and arrests, children of color, especially Black and Latinx and Native American youth, children in rural areas and children in poverty are more likely to experience this. And in Ohio, we are currently ranked 4th in the nation for the number of kids who have had a parent in jail or prison. The separation of a child from their parent via incarceration can unravel multiple household, caregiver, and economic disruptions upon arrest and throughout incarceration. Upon release of incarceration, a record of crime can limit where that parent can advance their education, can limit their ability to get aid, limit where that family can live, can change their relationships due to stigma, and limit where that parent can work. All of these pathways are known to affect the health and well-being of children. To prepare for this presentation, I pulled some of the latest studies that use data from either nationally or community representative samples and have explored the effects of parental incarceration, either mother or father, on an array of child and young adult outcomes. Most of these studies do not differ between jail or prison incarceration or the frequency, but they do control for other social disadvantages such as poverty and other pre-existing conditions. And they also, some of these studies do not differentiate between the gender of the parent incarcerated, although these are important considerations. By far, most of the work has centered on the behavioral health of these youth. Children who have incarcerated parents are more likely to report poor mental health problems, such as inattention, acting out, and problems with substance use. In addition, these youths are more likely to be justice involved, starting in adolescence, through young adulthood, and in later life. There have been studies linking state incarceration rates to higher infant mortality rates, and studies about how these children are more likely to have developmental delays, speech and language problems in early childhood, and have higher rates of obesity and asthma through young adulthood. Even less is known about the biological pathways linking a parent's incarceration to stress of the child, but earlier work of mine have found linkages to low-grade inflammation, and others are now reporting on how cortisol responses are dysregulated after witnessing a father's arrest. In regards to school, and this may illuminate the school to prison pipeline, these youths are less likely to be prepared for kindergarten and early child and when they're toddlers, and more likely to be expelled, suspended, skip school, in addition to new research indicating that they're more likely to drop out compared to those who have not had a parent incarcerated and adjusting again for poverty and other caregiver disadvantages. Other research has found that these youth are also more likely to have unmet healthcare needs, greater food insecurity, increased reports of being bullied, a higher likelihood to be in the foster care system and to stay in longer compared to other foster care kids who do not have a parent incarcerated. These children are profoundly resilient given the disruption of the family unit, as well as the utter lack of community supports that are in place when a parent is arrested, detained, and released from incarceration. All of these studies have relied on national or community-based samples and survey data, and they're all self or parent-reported outcomes. To take one step forward towards uncovering the clinical health of youth with any contact to the system, personal or parental, an explorative descriptive study was conducted using the electronic health record database of Nationwide Children's Hospital. And the question that I was seeking to answer was, can we identify and describe the health records of patients with probable personal or family history involvement with the justice system? The time period was from 2006 to 2020, and all health outcomes were measured as clinician diagnostic codes via the ICD-9 and 10 and current procedural terminology codes, which providers use to document after a visit. So essentially this was a large, for some simple terms, a Google search. This is a natural language processing supported search engine. And we use these following terms to search any clinician note written from February 2006 to 2020 from any provider that saw a child at Nationwide Children's Hospital. About 2% of the youth had a documented justice or correctional keyword in the chart from this 14-year time period, which was around 50,000 kids out of 2.3 million patients. This figure depicts the number of new patients with a documented justice keyword out of the total number of patients treated per 100,000 by year. As depicted, we find a steady increase in the incidence rate of youth patients with a provider documented justice keyword in their clinician note or in their chart across time. Even though youth with a justice keyword in their chart only constituted roughly 2% of the total number of patients, they made up a large proportion of all patients ever diagnosed with certain mental health related disorders. So to read this, this 2% made up over half of all of the substance use related disorders ever diagnosed at this institution. The blue bar is representing a child with a justice keyword in their chart, and then green are children who have that condition but no justice keyword in their chart. So a couple comments about the limitations. So diagnoses outside of this institution were not captured. It was just those Nationwide Children's Hospital. And keep in mind that Nationwide Children's Hospital is not just a hospital. It's a huge network of primary care offices, behavioral health centers, in addition to inpatient urgent care and emergency departments. And so these are only representing youth and families who felt, one, comfortable in disclosing this information, and a provider who documented this exposure. So these are underestimated counts of the exposure, and we did not verify these with administration records. And so these are some of the limitations. I also acknowledge the reciprocal nature of mass incarceration and community deprivation, which make understanding these relationships, methodologically challenging. And despite these limitations, the mark of any contact with the justice system is certainly worthy to investigate, considering the size and churn of our correctional system. So using similar keywords and in preparation for another project, we pulled 7,500 clinician notes found using these keywords, and a student went through and manually reviewed whether there was any contact with the justice system. So they read through notes and we highlighted the keywords, and you'll see there were notes. Around 80% of the 7,500 notes showed that the child had some sort of contact with the justice system. 60% of the notes indicated a parent had been incarcerated at some time point. So this is a historical context. 2% of those notes indicated both parents. The next highest proportion was self or youth incarceration, followed by other family, non-family members or friends. There were some notes that were unclear, just due if it was a very short text. And so of the 60%, 40% indicated it was father incarceration. 20% of those 7,500 notes were maternal incarceration, so on and so forth. And so again, all of those percentages are relative to the 7,500 notes. So when I switched to UC, or took my first position, we were replicating the exact methods of that study, and the results are eerily similar. We are in the process of refining the ICD codes that were pulled and refining those methods. We're going to be adding a comparator group of youth that come from a similar area and background, and that work and data should be coming out in the next few weeks. And so this is a chart that's just showing that from 2011 to 2019, Cincinnati Children's Hospital and nationwide had similar percentage of patients with justice keywords in their chart. I also want to elevate the voices and perspectives of the families and providers who care for children of incarcerated parents. So I wanted to share some of the qualitative work that I've conducted. So since 2019, students have interviewed over 30 providers and 30 families using convenience-based recruitment methods and flyers. Mostly the participants are from Ohio. So youth service providers relayed, well, I actually found out about the incarceration of a student's parent on the news. The next day, the student came to school and told me about it because the student and their siblings were scared and they didn't know what to do. I was working with a client who had been in 10 different foster care placements in a period of 15 years. These quotes highlight the need for better identification and timely linkages. There were stories of social workers who had to drive to the jail to get a parent's consent form signed so the child could get linked to behavioral health services. And so that is a social worker who went above and beyond, to reach out and go to the jail. Adolescents have shared, and then you get to sit and think about all the years that my incarcerated mom is away from their family, or if they are getting beaten up by a guard. That's scary to worry about regardless how far away they are. Another shared, if I'm in school and I tell teachers my mom's calling me from jail, then I think I should be able to accept that call. Or if I have to get picked up early for a visit, it's not an unexcused absence, but should be excused. I think these quotes highlight the things that some children, or one, would never have to think about. And then also how schools should be able to give excused absences to students who visit their parents in prison. Caregivers shared heartbreaking stories. 6 officers came into my house and it was terrible. My daughter was completely traumatized and they wouldn't let her near her father. They handcuffed him, shackled him, all of that in front of her. And in order to get any kinship care, I was told I had to put them in children's services and then give them back to me. And I'm not doing that. That they've been through enough. So the system just makes it hard for those who really need help to get it. Caregivers shared heartbreaking stories about the hardships of finding daycare, taking time off work, and the difficulty accessing services. There are 3 manuscripts that are in preparation or under review regarding the adolescents and caregiver perspectives. There are things we can all be doing upon arrest, during incarceration, and upon reentry. Of course, decreasing the number of parents incarcerated and other bail reform efforts would be the most important preventative strategy. Persons incarcerated who have better connection with their families inside incarceration have lower recidivism and decreased stress if they maintain those family ties during incarceration. Upon arrest, screening and social services linkages, additional trauma screening for kids who have seen a traumatic arrest. During incarceration, we can increase some family-friendly visitation spaces and events. There are great ones happening through ODRC, but they are few in number and limited in who can participate. I think decreasing the cost of connection, these were all voiced by the families that we've interviewed. Nationally, the average cost of a 15-minute phone call from jail is around $6 or up to $24 in other states. An informal investigation led by the Marshall Project found that the average monthly cost to stay connected to someone inside was about $63 a month. So I think during incarceration, addressing social needs of the family and having any peer support and caregiver support services in the community would be great. Other families mentioned the continuity of medical care for the returning parent and the importance of that, and family reunification services and support. So in order to achieve child health equity, the Robert Wood Johnson Foundation and Cincinnati Children's Hospital strategic plan states that we must remove obstacles such as poverty, discrimination, and their consequences, including lack of access to quality education, housing, safe environments, and healthcare. I think the consequences of mass incarceration and the family obstacles that incur after a parent is removed should also be addressed. The National Academy of Sciences, Engineering, and Medicine recommend in their latest report on increasing opportunity for all youth that we need greater collaboration among our health, justice, and child welfare systems to truly transform child health. Importantly, I think we need to ensure that we embed and engage families in this research and intervention work, and reduce the barriers to including those families to work within our own hospital systems and universities. Some of the work we're doing in Cincinnati, we're realizing that there are barriers, like even hiring someone with a felony is prohibited in some spaces, even if it's work designed to improve the health and well-being. I won't be going through all of these community and national resources, but I did want to highlight a few of these. And then for time purposes, I always like ending on the Bill of Rights for children of incarcerated parents. And this was established in 2005 by the San Francisco Partnership. And this was directly in partnership with youth who had incarcerated parents. And it's a roadmap of reform for safeguarding children. Turning these rights into realities is the ultimate goal of these collective efforts. But I do think children have the right to be safe and informed at the time of their parents' arrest, that these children are heard when the decisions are made about them, that they are considered, when decisions are made about their parents, so on and so forth. And then I'm happy to share any of these slides and the works cited. I'm happy to send a full list if you email me. So I will stop there and stop screen sharing. And I am happy to take any questions next 5 minutes.
Great. Thank you very much, Dr. Bach. We do have a couple of questions. One comes from Mark Rodney, who said that anecdotally, I've seen many kids in foster care who have a bipolar disorder diagnosis, and it seems disproportionate. Is there data to support this correlation? Is it possible that this diagnosis and medical management is inaccurate when PTSD or other diagnosis is more accurate for many of these kids? Is that something that you've looked at, or do you know of resources that we could point Mark to?
Yeah, I think we have a long way to go with our mental health care system in children. And I think you raise important points about diagnostic disparities and whether these are the right diagnoses. That occurs, I think, throughout the lifespan for not just kids and adults. But I haven't looked at that quite yet, but I think that'd be an important avenue to investigate. And so, yeah, I think you raised an important point.
Okay, thank you. Thank you. There was also a question posed in the chat box, and I'll just read it so that everyone, to draw everyone's attention to it. Kim McKinney asked, does the Handle with Care initiative address some of the concerns expressed by children, like unexcused absence, taking phone calls? And Natalie Kirk responded, I don't believe so. I think it just informs the teachers that the child had a contact with law enforcement. It would be up to school to do something regarding the absences and phone calls. And then there was a link to a website for those who are interested in learning more with Handle with Care. Do you have anything that you'd like to share related to that?
No, I'm happy to, I'm glad that resource was shared, and I'll be looking into that. So.
Okay, great. And then another question, what gains have been made in communicating these findings to Ohio legislators, county, and local governments? How have these bodies enacted reforms? Great question, because we're always interested in the connection to policy change.
Yeah, I think, so I have done university. This is the presentations that are open to public, but this is definitely, more research needs to enter some of those spaces. I think, yeah, another great point. And how have these bodies enacted reforms? I do think the Franklin County Board of Commissioners office recently received some monies to address some of these concerns that was raised in the research today that I presented on. There's great work that's hoping to be started to link incarcerated fathers in certain facilities in Ohio to fatherhood support programs, and working with their caregivers and youth to connect them to services. And so I do think there are initiatives that are occurring, and I think there are some great things that Nationwide Children's Hospital and Cincy Children's are doing to address social needs generally and screening. I think healthcare system and the justice space can work collaboratively through these. And so I think the support to build better data infrastructure and service linkages across these systems and sharing necessary data and to understand these problems are all good steps.
And I just want to mention that there is a piece of legislation pending in the Ohio House of Representatives focused on, the legislation calls for more study regarding adverse childhood experiences. I would, I'm just going to ask my colleague, Jacob Santiago, to perhaps put a link in the chat to that piece of legislation. But this would be a great opportunity for those of you who are on the call to spread the word about this research and other research that's been done on this topic. Share it with your legislators, and if you think it's important that the legislature take a deeper look at how incarceration impacts the health and well-being of children, let them know that, because they often want to hear from their constituents about pieces of legislation such as this. And then, of course, if the bill does get more hearings, weigh in, perhaps as testimony or letters as well. And I think we probably need to move on now. There was one more question, Dr. Bach, in the Q&A box. So if you wouldn't mind just responding to that directly, and I'll hand it back to Haley.
Yes, great. Thank you so much.
Perfect. Thank you so much. And thank you, Dr. Bach. So now we're going to turn our attention to a strategy for keeping families together or preventing incarceration. We're looking into family treatment drug courts. So today we have Terence Walton with us. He's the Chief Operating Officer at the National Association of Drug Court Professionals. And prior to this role, he was the Chief of Standards at the association. He was the Director of Treatment for the Pretrial Services Agency in DC. He's also an Ohio native, which perhaps he'll talk to us about. So join me in welcoming Terence Walton.
Thank you so much, and good morning. It is still morning. Good morning, everyone. It is a pleasure to be here. Hey, am I going to share my screen, or are you controlling it from your end?
You are set up to share, to move the slides.
Oh, to move the slides. Okay. All right. So, it's my honor to be here for this this discussion. And I appreciate the fact that the planners, the folks at the Health Policy Institute of Ohio, thought about family treatment courts as a part of this discussion. And that's not obvious, but I think it's an important inclusion. And I'm happy to talk with you for just a few minutes about that, and then have a couple minutes at the end to answer any questions that you have. You know, I think I'll begin this way. So Hallie is correct, and I am a proud, born and raised in Dayton, Ohio. And I went home last weekend to celebrate my father's 80th birthday with my brothers as well. And, in preparing this presentation and thinking about my time with my dad and my brothers, I realized how important it is, how important it was, and how much it influences me today that I was raised by my parents. That there were two parents in my home who raised us, and all of us had different paths, and some of us struggled more than others, and my parents had their own struggles and were far from perfect, and we weren't rich working class folks, good union jobs. There was all kinds of stuff, but their presence there really mattered. And I'm convinced that both me and my two brothers are alive and well and thriving today because of that. It reminded me how important this discussion is. There are around 3,500 to 4,000 drug courts in the US, and about 500 of those are family drug courts, family treatment courts. And I don't get the opportunity to talk about the family treatment court as much. And in some ways, family treatment courts, I believe, include everything about drug courts that really matter. And while families matter in all kinds of drug courts, families matter in regular adult drug courts and veteran treatment courts and DWI courts. But when it comes to family treatment courts and also juvenile drug courts, it's all about the family and family recovery. And so I want to talk about that some today, but here's what I want us to focus on. We'll talk a little bit today about the nexus between substance use disorder, as you just heard Dr. Bach describe, as well as family separation and incarceration. And the incarceration piece is not the obvious piece, because family treatment courts are not a part of the criminal justice system. they're part of the family court system. But there is a nexus, and that's why I'm glad we're talking about it. I'll spend just a couple minutes being sure you're clear on what family treatment courts are, and whether I say family drug court or family treatment court, it's the same thing, what family treatment courts are. And then I'll begin, in my own way by sort of making the point that even if you are blessed to have a really well-run, evidence-based, fully functioning family treatment court in your community, that's never enough to make the kind of impact that we need to make. And so I'll end with that. So this is to be about the solution, not the problem, but if I may, I'll begin with a tiny bit of the problem to sort of help to set the stage. So the question could be asked, so how many children in the child welfare system have a parent in need of treatment? And you see several studies listed there. The study done by Young and colleagues in 2007 estimated between 60 and 80% of substantiated child abuse and neglect cases involve substance use by at least one custodial parent or guardian. And those numbers very well may be underreporting the true extent of the connection because many communities don't do a good job at screening for and looking for the possibility of substance use disorder contributing to child neglect or abuse. About 61% of babies and 41% of older children who are in out-of-home care have a parent in need of SUD treatment, substance use disorder treatment, and related services. And then another study from 2007 estimates that 87% of families in foster care have at least one parent in need, and 67% both parents are in need of substance use disorder treatment, meaning they are living with moderate to severe substance use disorder addiction as just one of the issues. So the need for family treatment courts are clear. And even though family treatment courts can't do the whole job, but communities that have access to a family treatment court, it really matters. So what's the connection? What about the connection between reducing incarceration and what family treatment courts do? Because again, individuals involved in family treatment court aren't automatically a part of a criminal matter. They often are not. Sometimes they are, but they often are not. In fact, more commonly are not. And so what's the connection? And the parent isn't at risk necessarily of going to jails or prison. The real risk is losing custody of the children that they love. So what's the connection? Well, I think there's a couple connections that I want to begin with. I think one of the truths is, while it doesn't always occur, that those at risk for loss of custody of their children may very well also be at risk for justice involvement. The kinds of things that substance use disorder does to a person, the criteria itself, how among the criteria for substance use disorder for many is the fact that the disorder keeps them from properly managing their lives, properly taking care of their essential responsibilities, impairs them in all kinds of ways. And in some cases, the very kinds of things that can happen to result in loss of custody of your child could also result in justice involvement. The same kind of dysfunction, the same kind of loss of good judgment because of the substance use disorder, and the fact that the nature of addiction, the essence of addiction, is it becomes more important than anything or anyone else, whether the person wants that to be true or not. Doesn't mean the person, the parent, doesn't love the children they bore or caring for, but addiction has a way of pushing everything out. And so those the risk of custody, those at risk for losing custody might very well also be at risk for justice involvement, may be involved or at risk of involvement. I think it's important for us to remember that because family treatment courts focus on family separation can result from either because a child was removed or because a parent was removed due to some criminal activity. And either one that occurs, the impact of a parent and child being separated is what it is, even when that's the best thing. And often that is the best thing for right now. But even when that occurs, that comes at a cost to the child, cost to the parent, cost to the community. You know that. But the good news is, this is really about solutions, is the same kind of treatment, the same kind of recovery management supports, the same kind of wraparound case management services that are provided to parents involved in family treatment courts to address their substance use disorder and co-occurring disorders. Those same kinds of services can also reduce the risk of justice involvement. And so if we have a parent who hasn't yet become entangled with the justice system, who hasn't yet been on that path that often ends in incarceration, or sometimes what can be worse than incarceration, and that is supervised probation and release, that becomes onerous and intrusive and expensive, even when necessary, that the same kinds of help that parents are getting when they're in a well-operated family treatment courts can also help to reduce their risk of justice involvement. Drug courts of all kinds exist because of the connection, the nexus between criminal activity, in the case of family treatment courts, child abuse and neglect, the connection between substance use and those things. And so providing effective addiction recovery treatment and all of the supportive services that need to go with that is a great strategy for preventing both family separation or encouraging family reunification safely, as well as reducing recidivism or a criminal activity. And the final connection that I see involves the focus on children, because the purpose of family treatment courts is ultimately to protect child safety, to ensure a permanent caregiving environment and promote children's well-being through family recovery. The focus is really on the child. And so there's no family treatment court that, in addition to servicing the parent who is a participant, isn't also focusing their attention on the well-being of the child, on helping to support the child's resiliency, to help to increase protective factors, to help increase their recovery capital. And this is really prevention. This is helping to provide, I saw in the chat, someone talked about the possibility of undiagnosed, unrecognized post-traumatic stress disorder or other trauma-related disorders in children and others. I think that is absolutely correct. And so treatment courts that focus on children as well as teenagers who may be living with trauma, other mental health issues, and other factors, supporting their success and their school success, and being sure they're in a safe environment where their basic needs are met. Research says to us that's good prevention, preventing both the initiation of problematic substance use, as well as to help reduce the likelihood the young person will become delinquent. All of those things matter. I've got to move, folks. I just looked at my little timer here. I got to move. All right. So there is indeed a nexus. Let's just talk a little bit about the family treatment court population. In particular, again, family treatment courts are drug courts, and they serve families who are in need of treatment in order to successfully complete the child welfare service case plan. That's at its most basic level. And for some in family treatment courts, the out of home, there's already been a petition to the court, a child or children have already been removed from the home, and others that hasn't happened yet. And the children are still in the home while under the supervision of the court as well as the caseworker. We try and help the family get what they need to improve. I'll let you look at these ingredients on your own, these key components of a family treatment court. You can look at some of them on your own. I want to focus on the fact that the part of how the family treatment court model works is we're identifying families who would benefit from treatment court as early as possible. And part of the bottom line here is early identification matters not just for those who are already at the point where their only option is court-involved family treatment court, but early identification really makes the most sense for those who are not yet at that point. Look at those other ingredients as well if you're not clear on what a family treatment court is all about. So in general, where do family treatment courts, where do they sit sort of in the larger system? I'm not certain what your situation is, where you're located in Ohio, but throughout the country, for the most part, family treatment courts are sitting sort of on top of a system, on top of a child welfare system, and sometimes on top of a healthcare system that is largely unchanged. It's almost like a diamond in a dollar store. And it's separate from the larger system where it's help being delivered on the margins and not brought to scale. And we are hopeful, and my recommendation is that we support policies that incorporate the essential elements of family treatment courts well before a judge is ever involved. That's part of how we help communities make the most of their family treatment court, and that is by doing what they can to strengthen the systems, the services, the collaboration between partners that occur before the court has been petitioned, before a child has been removed. There's sort of three ways this can happen, and if we can get to the top model, that's the best option, where before a petition has been filed with the court, the healthcare treatment system is able to be engaged through clinical case management, so the family, the parents, and children get the help they need to help the child stay safe without even a court petition being filed. A next level is when a case has been opened, there's a safety plan put in place, things are sort of the court component is sort of held in abeyance while we see if the combination of the healthcare system and the child welfare system can help the individual get in place. So again, that first option, that pre-file option, hopefully can occur without child welfare involvement at all. This next option, we've added now a child welfare caseworker to try and help the family recover. And then the third option, this is where many family treatment courts kick in, is when it's both the healthcare system, the child welfare system, and the court is now helping the family to recover by focusing on helping to ensure the parent gets what they need as well as the child. And so my point here is, in every community, we need options at all three of these levels. And the best way, the way that reduces the risk of harm the most, when it's safe to do so, only when it's safe to do so, is that first option. And then the next one. And then the next one, where family treatment courts come in. People need the level they need, and some will need to start right at that third level. But if we can identify earlier and assess and treat and address earlier, we can reduce the risk of harm. So let me wrap up kind of with this sort of, and that is, this in a nutshell is sort of a quick version, a quick visual of what family treatment courts are about. It's about the therapeutic piece, a compassionate judge who uses the leverage that he or she has, as well as the power of connection between an authority figure who cares and in this case, a parent, using that piece, both the compassion as well as the accountability that can come from a judge involvement, combined with intensive case management and recovery supports and enhanced family-based services. That's drug court. If you look at that, folks, though, the only piece of that that shouldn't apply across the board is the judge piece. Without the judge involved, if we can accomplish what we want, intensive case management, identification, assessment, case management, recovery support, enhanced family services occurring before a person is ever considered for family treatment court, as well as after they leave a family treatment court, That is how you build resiliency. That's how you reunify families and hopefully prevent justice system involvement that might result in incarceration. You've heard some about inequities already. Those exist not only in the justice system, inequities also exist in the child welfare system. We know that, you can look at some of these stats on your own, that Black children as well as Native American children are overrepresented in the child welfare system, in the foster care system, and beyond. So as you are looking at your data, looking at your outcomes, looking at what the state of affairs is where you are, look at the entire population as well as subgroups to see if you have an equity or the disproportionality issue and see what you can do to address it. Final slide, folks. This is from one of the handouts I provided for you. I give you two handouts, two publications actually. One is the Family Treatment Court Standards. So if you work with an existing family treatment court, or if you want to start one, there's a list of standards produced by both NADCP and Children and Family Futures that outlines how family treatment courts should operate based on evidence. Also, I'm giving you a publication on guidelines for states as they, if they're interested in building a family treatment court. And I included that because most of the components in that document, in that publication, the ones you see summarized on the screen, would apply to any community who is trying to better address the needs of children and families where there's the risk of child removal. That the same steps, the importance of collaboration, of multiple partners, would apply even if the end result wasn't going to be family treatment court. I wish I had more time, but I don't. And I don't even know if we have time for questions, but we do. I'm certainly willing to take some.
Great. Thank you very much, Mr. Walton. Very much appreciated your presentation. Alana, do we have a few moments for questions?
We do.
Okay, great. Well, in particular, we appreciated that you highlighted the racial disparities that exist. We have a question here that is related to disparities for LGBTQ young people. So the question is, we know from research that LGBTQ young people make up 20 to 30% of those involved in children's services and the juvenile justice system. Do systems like family treatment court, are they adequately able to support LGBTQ young people who may have experienced trauma due to family rejection?
Well, it's a great question. And there's certainly a heightened awareness of this particular population within the family treatment court and the larger treatment court world. Absolutely. At our national conference that we have every year, we do a number of sessions on equity and inclusion, including multiple sessions on how better to identify the unique needs and risk involved with individuals who are LGBTQ. And so I wish I could say that every treatment court is ready and recognizing the unique needs of that population. I don't know that that's true, but I do know there's an increased focus and a desire to gather more information, to develop more resources, and through individualized clinical case management, ensuring that those individuals have their needs met as well. So we're, I believe, in a better shape than most of what's involved in the justice system, but there's of course still work to do.
Okay, great, thank you. And then there was a bit of praise here from Vance Green, who said that I think this entire presentation should be written as a proposal for the American Corrections Association for their next Congress in New Orleans.
Hey, I think that's a good idea.
Hey, and going to New Orleans is never a bad time.
Any excuse I get.
Mr. Walton, I wonder if you would leave us, we're going to take our break right after this. I wonder if you would leave us with one policy change that you would recommend. Like if you could wave a magic wand and one thing was different about how we approach child treatment courts, about how we approach the intersections between substance use disorder, family well-being, and the criminal justice system, what's one thing that you would want to see change?
I think however it happens, and the particular policy will be different depending on where we are, but everything we can do to remove the barriers that currently make it hard for various systems to work together. We cannot really get to the system unless the child welfare system, the larger healthcare system, and in some cases the family court system and juvenile justice system are able to work together actively without barriers. It often takes funding to fund efforts to allow systems to communicate, to allow time to develop the kinds of things listed on my last slide, the shared vision, the shared mission. And that really is the secret of drug courts, that they have found ways, in some cases, those states have supported that through legislation that compels systems to work together and removes barriers to that happening. I think that's critical. And any policy that would support that, allow collaboration, moving barriers in support of a common goal, I think is worthy.
Thank you so much for that. And thank you for your presentation today. Everyone, we're going to take a little break here, about 15 minutes, allow you time to stretch, stand up, move around, get a little bit of something to eat, if it's time for you to do that. And we'll be back together at 12:15 for our last presentation. Thanks, everyone. All right, everyone. Welcome back from the break. It's nice to be with you all. Hope you're enjoying your lunch or water or whatever you got during that time. We're going to end our time together today with some information about the current bail reform efforts that are happening in our state. So we're going to hear first from Greg Bennett, who's a partner at Myers Mitten Associates. We see him on a slide here. Perfect. He's going to provide an overview of the bail reform bills that are currently up for consideration in the General Assembly. And then we're going to hear from Pete Van Leer, who's a senior researcher at Policy Matters Ohio. And he's going to discuss some of the research that Policy Matters has done on those bills and the opportunity that Ohio has to support children and families by reforming money bail. So we'll first turn it over to Greg. Thanks, Greg.
Wonderful. Thank you, Haley. And thank you for having me today. Good to hear from everyone and really important discussion we're having. So I appreciate the opportunity of being a panelist. And in addition to all the work that's been done in this space, we've had the pleasure of working with the Health Policy Institute of Ohio. Thank them for hosting this forum and obviously the important work that they undertake every day to make Ohio a healthier place. So today, as Haley had mentioned, I am going to be talking about the Ohio money system bail reform efforts in the 134th Ohio General Assembly. We're currently halfway through the General Assembly process, but there is an optimistic outlook for these efforts that have been undertaken over the past several years and several iterations of General Assemblies on 2-year cycles. And just want to talk about 2 pieces of legislation that are currently underway. As it relates to the proposed legislation, while the initial concept of bail reform, or bail, I should say, is centuries old, we've seen in recent memory, I would say 3 iterations or generations of bail reform efforts, specifically in the United States. So first, around the 1920s, we saw an effort which eventually culminated in the 1966 Federal Bail Reform Act. And what this act did is it included provisions that were around the social science research that was taking place at the time regarding flight risks for the accused, pretrial service agency development, reviewing non-monetary and personal recognizance avenues for pretrial release. But following the passage of this act, as the first generation of bail reform in the United States, there was an influx that the country saw of accused defendants fleeing prior to their initial hearings. Therefore, in the 1970s, what we saw was an increased focus on this issue, specifically to the flight, and an examination of the potential threats posed by some individuals accused of those crimes. Thus, we saw this second generation of reform efforts through the Federal Bail Reform Act of 1984, and previous to that, a DC Court Reform and Criminal Procedure Act of 1970. Both of these were aimed at bail, no bail options, and again, threats of flight and or harm to oneself or others if they were to be released pre-trial. The 1984 Act, I would say, is what's commonly used across the United States in individual states as the legal guidepost for the bail system. Although I would say, and the reason for what I'm going to talk about in the 3rd generation of bail reform efforts across the United States, including in Ohio, states haven't always embraced these changes from the federal government. So we do have this 3rd generation, which I'll get into, of reform efforts. This is an approach that's bipartisan in nature. It's focused more so on individual state policy changes. And, as we've seen today from the previous speakers, the extensive research on these criminal justice issues, it is this type of research and data that has led to identifying these issues and unintended consequences for individuals, families, communities within the current policy environment, and with a targeted focus on both release and detention for this 3rd generation. So this brings us to our current policy discussion in the Ohio General Assembly. We have 2 bills currently pending. And these 2 bills, Senate Bill 182 and House Bill 315, actually came about and were developed following a 2019 Ohio Supreme Court report study of recommendations on recommended reforms in the bail process. So as a I'll go back real quick. Apologies there. As it relates to the current status of the legislation, our state legislature has just arrived back in session from the holiday break. They do have a specific target and an eye toward redistricting efforts. I'm sure many of you have heard about the recent Ohio Supreme Court decisions invalidating state and congressional maps. So that is taking up a lot of time over the next week or two, plus potentially. So while this will be the main focus, we do have two pieces of companion legislation in the Ohio House and Ohio Senate focused on addressing money bail reform efforts in the state. So Senate Bill 182, sponsored by Senator Stephen Huffman, who's up there on the top left of your screen there. He's the chairman of the Senate Health Committee. And then you have Senator Rob McCulley, who's the majority whip of the Ohio Senate, who's on the top right there. And then in the House, you have House Bill 315, which is sponsored by Representative Brett Hillier, bottom left, and Representative David Leland. One thing to note about this is the primary sponsors on the House bill are bipartisan. Representative Hillier is a Republican, Representative Leland is a Democrat. That's not to say that the Senate bill isn't bipartisan. What we have in Ohio from a legislative standpoint is a maximum of 2 primary sponsors, and then there's a whole list on both of these bills of co-sponsors, and for both of the bills in both chambers, it is bipartisan in nature, which is good to see. The bills are identical in terms of their legislative language, and the one caveat being is that the Senate bill is currently a bit farther along procedurally. So what we've seen here is that the Senate bill has been given a second hearing, most recently June 16th, mid-June. And notably on this second hearing, which was a proponent testimony, there were 47 individuals and or organizations that submitted public testimony before the committee. Many of them came in to speak before the committee. We'll talk about ways to advocate in just a minute here. And what was refreshing about this, similar to the bill sponsors and co-sponsors, is that the advocates and organizations involved crossed a broad swath of the political spectrum and coalition support. Before we go into some of the details around the bill, I did want to point out that although we are halfway through the session cycle and heading into a truncated legislative schedule, given the May primary election and November general election in Ohio, I am personally optimistic about these bills for several reasons in terms of their progress and potential passage to the governor. One, the bills have bipartisan support from both advocacy organizations and legislators alike. Again, while we only have these 4 primary sponsors, there are numerous co-sponsors on both pieces of legislation. Secondly, I would say that the primary sponsors in both chambers are key policy influencers in their respective legislative chamber and their respective legislative caucuses. So you've got a good core group of 4 individuals that are policy decision makers in both chambers there. Third, these are companion bills. This is a unique aspect of the legislative process that tends to expedite the overall process by giving the same language hearings in both chambers running concurrently. They can choose how fast they want to move a particular bill, but what it does is, let's say the Senate bill ultimately passes and the House bill, which is the exact same language, has had 2 hearings. You can expedite that Senate bill, get it through the House committee process in a quicker fashion and hopefully pass. So that will kind of be a countermeasure to the truncated legislative cycle we had due to the elections. And then fourth, this issue has been discussed for several years now, and it's my belief that the current legislation was developed after intense scrutiny and review of previous legislative efforts, including that 2019 Ohio Supreme Court report of recommendations. So getting into just a brief overview of the proposed legislation, it's clear that the goal here is to correct inequities within the Ohio bail process. The focus, apparently, what it appears is that on the threat and flight risk of individuals, rather than their financial stability or individual circumstances to pay money bail. What this is going to do, if passed, is it's going to fundamentally reshape Ohio's system of Ohio courts relying heavily on bond schedules to set pretrial detention conditions. So this legislation requires all defendants be released prior to their hearing, unless there is noted concern for flight and or harm related risks from that individual. It's found that if it is found that the individual may run afoul of any pretrial release conditions that are set by the court can develop further conditions within required timelines for the hearing schedule, which you'll see on the slide there under the bullet point. These timelines include a presumption of release for all individuals within 24 hours, or a condition of release hearing within 48 to 72 hours, pending the accused crime that has occurred, or the charge that has occurred, if there's an individual risk identified by the court. So this condition of release is a process where there's myriad considerations taken into account by the court, and requires the court, judge, magistrate, what have you, to identify less restrictive conditions of release if and when applicable. The bill does repeal existing laws specifying language around secured bail and bond as a security for the appearance to a court or magistrate at any time. That does include the deposit of cash by the accused, bonds set by the court for the accused, or recognizance, which is the written undertaking by a person to forfeit the sum of money should they be in default of their first hearing. It does repeal that provision and instead specifies that there is a presumption that any condition of release the court imposes must be non-monetary. However, a court may order that an accused person post a secured bond only if there is clear and convincing evidence that the accused will not appear at a future date and time during which the accused is required to appear before the court. An important aspect when it comes to these monetary requirements, if they're set on an individual, the court must make an ability to pay inquiry for setting these secured bonds. So this would include a financial hardship affidavit signed by the accused, a calculation by the court for the maximum secured bond the accused can pay. And specifically on that note, the court can only set a secured bond amount based on the amount the accused is able to pay, and that the maximum secured bond set by the court for the accused is 25% of the total amount after the accused's total monthly expenses are deducted from their total monthly income. So it's that net amount, and that's 25% of the total amount for that monthly income. So again, while I'm optimistic about a path forward, the legislative process is complex. We've seen examples of really well-intended bills in previous years unable to pass the General Assembly for a number of reasons. A main example that comes to mind is another bipartisan criminal justice reform effort, Senate Bill 3, that dealt with drug felony declassification efforts. This died in the House last year due to some opposition from the judiciary and law enforcement. A key difference for bail reform, which again makes me optimistic, is the support from these entities, both the judiciary and law enforcement officials, which is critically important to any sort of criminal justice policy modernization getting through the legislative process. Recently, Chief Justice Maureen O'Connor, she came out in support with that recommended report. She did, in fact, in previous General Assemblies, oppose Senate Bill 3, that drug reclassification effort. So I think having her in the court's support here is hugely important for this effort before the end of the year. And then advocating for change, I promise this will be my last slide, but there are several ways to get involved. Apologies about the typo up there on the slide in that first bullet. If you're passionate about this policy area, changing this at the state level, these efforts do include contacting your specific state elected officials, identifying legislative leadership members, which I can certainly provide links to those folks and their contact information if you wish. That does include committee members of jurisdiction where these bills currently are sitting. So in the House Criminal Justice Committee and the Senate Judiciary Committee. And all of this would be open to public outreach and communication if you so choose. What I would recommend is express why you want to see the legislation pass, how it's important to you personally or to your family or community. Personal examples are always good if you have them. Data is always good from a macro perspective. And also organizational coalition development and support, finding allies on the ground is also hugely important. We kind of operate in the advocacy world that there's always strength in numbers. And when you have a diverse, large group of individuals and supporters of a piece of legislation, that is important and almost necessary for passage of a bill. So identifying those on the ground partners. And then another option is outside of capacity building and submitting public testimony, actually going before committee. The way to submit public testimony, you could either do it in written format where you don't have to go before committee, but it's in the public record, or you can actually address the committee where you're subject to questions from legislators. But I think it's important to note, if you do, decide to take that route, consider yourself an expert, be confident. Even if you're not focused on this all the time, if you're passionate about it, the legislators are spread thin in terms of their policy areas. They're jumping from one policy to the next every 10, 15 minutes. So they're looking to you and to us as the educational sources for them to make the best decisions possible when it comes to public policy. And then lastly, earned media opportunities to advocate your positions, letters to the editor, being involved in editorial boards, other mechanisms within that kind of communications, public affairs realm are always an important advocacy tool. So, and I would say, especially as elected officials, often read and watch local and statewide media daily and several times a day. So with that, I know that was a lot in a short amount of time, but want to make sure we can fit everything else in. Happy to answer questions.
Thanks so much, Greg. And what we're going to do is actually hold questions till after Pete presents, and we'll talk bail all at the end. Really appreciate that overview, Greg. Thank you so much.
Thank you.
And, bail reform, as Greg sort of laid out, is happening in Ohio. The conversations are happening in Ohio. This is a method, right, for incarcerating fewer people, particularly people who have not yet been convicted of a crime. And this is just one way, one strategy for keeping families together who have become justice involved. So we're going to hear more about that from Pete Van Leer from Policy Matters, who's going to talk about their research on this topic. Thanks, Pete. Pete, you're very welcome to turn on your camera and mic at this point.
And I'll move your slides along for you.
So Haley, it looks like he's having trouble accessing the controls. What I noticed is that for Pete, if he's able to, on the right side in your kind of name box, if you can see yourself, that's where you can access the controls rather than at the bottom of the screen, if that's helpful.
Thank you, Greg.
Mm-hmm.
All right, sorry for that. It just
That's okay.
My controls there, and I wasn't quite ready for that. So thank you all, and sorry for that delay. I've never had that happen to me before. So, but thank you to HPIO for the opportunity to talk about this today, and thank you, Greg Bennett, for the great summary, not only current reform efforts, but the history of money bail. So that's really helpful. A couple of things that Greg said, he covered some things, so I'll be able to move through a couple of my slides pretty quickly so I don't repeat anything. So I'm with Policy Matters Ohio, a researcher. With that organization, we're a state policy think tank focused on, focused on really creating a more vibrant, equitable, sustainable, and inclusive Ohio. And we do that through research, strategic communications, coalition building, and public advocacy. So over the course of this summer, once these bills were introduced, we wanted to look at how we could, as a research organization, impact this work and what we might bring to it. And what we ended up doing was really taking a look at research that's been done around the health impact of pretrial incarceration. So that's kind of what I'll be presenting on today. We come from the belief and the understanding that all Ohioans deserve a criminal legal system that treats everyone fairly, no matter race, income, gender. But as you probably know already, many Ohioans are in jail before their trials, before they're even tried. They're still innocent under law because they can't afford to buy their freedom. And the ACLU did a report a couple of years ago looking at this issue, and they found that on any given day, as many as more than 12,000 Ohioans are incarcerated as they await trial. Compared to, there's been a huge increase since 1978, and I think Greg touched on why some of that has happened. So even though overall crime rates have fallen, people in jail pretrial often outnumber those who have been convicted. So that's where we're coming at on this. I think Greg has already talked a little bit about what money bail is, and the impact of it is that it leaves people in jail for days, weeks, even months. And there are disparities very clearly along lines of race and class. Nationally, some 90% of people are in jail pretrial because they can't afford bail. Even though research has shown that it really doesn't do much to ensure that people will appear in court. Impact on Black people, the systemic racism that's baked into our system, the judicial system. So even similarly charged white people are less likely to be jailed and to be released without requiring bail. And they also even face discrimination, making it harder for them to get good legal representation, especially given the weakness of our public defense system, the understaffing and the underfunding of it. So we've talked about these two bills. I think there's a sub-bill happening right now, a substitute bill that could change some of the details of it, including the timelines in the period of release, the 24 hours, the 72 hours, that kind of stuff is in flux. And these bills, from our perspective, they would reduce the likelihood that people accused of crimes lose their jobs, their housing, custody of their children, lessening damage. It would lessen the damage to the health of those who otherwise would be held while awaiting trial. And requiring, one of the big aspects of it is requires judges to provide written explanations when they do release people with conditions. So that's really, really important. So here are some of our findings, right? So we're looking at mental health. Pretrial incarceration increases stress. And this is all based on a lot of national research and some Ohio research, but really looking at the impact of pretrial incarceration. So it increases stress, can degrade the mental health of individuals who are detained because they're confined, they're away from their families, and they're often in jails, which are, by many accounts, you're better off if you're in a state prison than a jail because the conditions, the uncertainty of being there while you're not knowing what's going to happen next. Suicide is the leading cause of fatalities in jails. Death rate has grown over the past 2 decades. And the mental and physical healthcare needs of many people in jail, jails just typically cannot meet those needs. They can't provide the right kind of treatment for people. So this is what makes, this is a big mental health issue. If you look at the Cuyahoga County Jail, in the past couple of years, they've had several deaths. They had about 9 deaths. There was just another recent death. It led to a lot of they actually convicted the guy who was in charge for his actions during that period of time. And physical health was part of that. Our criminal legal system rapidly cycles people in and out of jails. So there's little time to screen and treat them for illnesses like, HIV and tuberculosis are 2 examples. The pandemic was a really laid bare that issue. The jails turned out to be incubators for COVID-19, not only within the jails, but people coming and going. It fueled the virus's spread into the population. So you're cycling people in, they're held for maybe even 24 to 48, even just a week, and that they're exposed, and then they bring it back out into the community. And we saw that happening not only in Ohio, but across the country. Violence, people are increased risk of being victims of violence because they're in jail. Trans people are particularly susceptible to this, 10 times more likely to be victims of violence. And that's violence at the hands of other people who are incarcerated, violence at the hands of staff, a whole range of problems there. So children and families, huge impact on children and families. There was a study that found that 7% of US children have experienced a parent encountering the criminal legal system. And the racial disparity is huge there. We've got, of that 7% of US children, Black children are 7.5 times more likely, and Latinx children are 2.3 times more likely to have an incarcerated parent as compared to white children. The studies are very clear on this. Children with incarcerated parents can experience much higher rates of high stress, anxiety that can hinder development. There's other mental health issues, depression, post-traumatic stress disorder, future alcohol and substance abuse, antisocial behavior. And this can lead to negative life outcomes in the short term and the long term, and even increases the likelihood of contact with the criminal legal themselves for the children of people who've been incarcerated pre-trial. It also decreases their economic mobility, their economic outcomes long term, and more likely to be in foster care or to experience homelessness. And it impacts their achievement, their ability to achieve comparably to others in terms of school. Disciplinary infractions, they drop out, they just don't do as well educationally. Effects on women are also part of the research. Women often take on financial responsibility for court fees, attorney fees, living expenses, and caregiving. When their partners are, for example, when their partners or people in their families are incarcerated pre-trial, the burden often falls on women. And this is despite the fact that in the workforce, women are less likely to participate in the formal workforce, and then when they do, they're, as a whole, on average, they are paid less. So this impacts children, even when parents, the mother is trying to deal with this issue, but especially, of course, when women are detained pre-trial, particularly for longer periods. And women, going back to the physical violence piece, women are more likely to become victims of sexual violence by other incarcerated individuals and jail staff. So this, of course, harms their physical and mental health. So one thing that has come up, after we released this paper, we've been in conversation, and it's an ongoing discussion with advocates for domestic violence. And it's becoming clear that I think there's going to be some work happening on this substitute bill and going forward with this legislation to make sure there are adequate protections for victims of domestic violence, because most domestic violence charges tend to be misdemeanors. And currently that would mean, under the legislation as it's written, it would appear to be that judges would have much less opportunity, if any, to hold or put any kind of conditions for release of people who are charged with misdemeanor domestic violence. So that's a very real concern. It's something that needs to be dealt with in this issue, in this legislation, because the overall impact is very, very clearly a positive impact. And the people I've talked to who are advocates on domestic violence and the issue understand the value of this legislation, but are very concerned about the impact on victims and victims of domestic violence, and possibly creating opportunity for them to continue to be victims from the same people who may have been able to be held before, but would no longer be able to be held under the same rules. So I know, let's see, sorry, I'm in a technical issue here. So I also want to touch on briefly the effects on LGBTQ plus individuals. So the national research shows that 1 in 6 transgender people have been incarcerated. 1 in 2 transgender people who have been incarcerated are Black. So there you have that intersectionality between Black and LGBTQ. courts often impose high bail amounts because they consider these individuals to be a greater flight risk. And in a national survey, 74% of LGBTQ plus respondents said they'd been held pretrial simply because they couldn't afford bail. So the problem that's experienced by the general population that is incarcerated pretrial is much worse for people in this community. And also the rates of abuse and sexual assault are higher for this community as well. You know, in the end, you know, we see very clearly that cash bail, money bail piles more issues onto systemic inequality that already has such a disparate impact on people who are low income, women, Black and brown people, and those in the LGBTQ plus community. And I would also add to that, people who have issues with drug abuse and substance abuse. The clear presumption for release without relying on risk assessments and onerous pretrial supervision is really an important part of this. Again, with the caveat that there's a lot of issues that need to be dealt with around the domestic violence piece. So this, our analysis of this is that would really free thousands of Ohioans from the trap of the current bail system and really create a more humane and just system, criminal legal system in Ohio. So thank you for that. And I think we're going to take questions now.
Great. Thank you. Thanks to both Pete and to Greg. So I'm going to take a look here at the questions. Well, I do see a couple of questions from Rebecca Klein about the issue of domestic violence and sexual assault and stalking. And she also made a suggestion that victim services agency or advocacy organizations are in support of bail reform as long as protections for victims of crime are protected. So thank you. Thank you very much for raising those questions. And it looks like ODVN, the Ohio Domestic Violence Network, has some specific suggestions that they'd like to offer up for how to improve the bills.
I would say that I see Michaela in the chat. She did a really good. She had an op-ed in the Dispatch recently.
Mm-hmm.
I think that might be worth highlighting.
Mm-hmm.
I could put that. I mean, I could put that link in the chat if you all want.
That's a great idea. We saw that too. It was excellent. So I think it would be great if you or somebody from the HPIO team could stick that in the chat.
I'll just note that Dr. Bach also wrote an op-ed on bail and child health and well-being that she threw in the chat as well. So there's been a lot of good work on this happening recently.
Wonderful.
Amy, I saw if you don't mind, I saw a question, I believe, about misdemeanors, and I know Pete had touched on this a little bit, but the bill does in fact say that, you know, it does modify existing law where anyone who's charged with a misdemeanor must be released on an unsecured bond or after a conditions of release hearing. There are a couple of exceptions, however. So they remove misdemeanor vehicular homicide and vehicular manslaughter. So there are aspects within the misdemeanor classification where you potentially have the, chance to be detained, I guess you should say. And then to Pete's, I think Pete also mentioned this, but as it relates to the question about stalking and menacing, there are required mental health evaluations if someone is charged or accused of that or has a previous background of that.
Okay. All right. Any other questions? Please go ahead and type them in the Q&A. And I'll just mention too that we have been and will continue to post resources on the forum events page too. So we'll add some of the resources that were discussed today to that page as well, so that people, once the chat closes down, you won't lose track of those.
I'll just add, as you all are thinking of additional questions to ask our speakers, this is an opportunity. Right now in the state of Ohio, there's an advocacy effort going on around bail reform. And we know that this is an evidence-based strategy for reducing incarceration, which has, for all the reasons that we said today, positive health impacts and well-being impacts on children and families. So this is an opportunity for anyone on this call to get involved, to think about ways to engage in the policymaking process around this issue, if these are connections and things that you care about and are passionate about in your work or personally. Greg shared a great slide with different ways that you can get involved in the policymaking process. I'm about to share another slide with some options of how to do that. So I'll just leave us with that.
And I did put a link in the chat to the state legislatures, the Ohio General Assembly's page, where you can look up your state representatives and your state senators. You can find the committees that Greg mentioned earlier. Lots of resources are posted there and publicly accessible. You can also watch committee hearings too, virtually now, which is terrific, because it used to be that you'd have to go to the State House and sit in very uncomfortable chairs for hours and, to even participate in the process or listen to what's going on in the process. And now you can do that virtually, easily. You can sign up to get notices of committee hearings on specific bills too. So if this is something that interests you, there's lots of modern tools available to do so.
Well, thank you very much to our panel of speakers today. We so appreciate your time and the wisdom and the experience that you share with us. And thanks for all of you for joining. We have a couple of evaluation questions to wrap up our day. I'm going to have Alana throw the first one. We're always thinking about how to improve these webinars and how we can make them easier for you all to participate. So if you could go ahead and give the webinar a rating for us. We also invite you to write in the chat, let us know if you have suggestions or feedback.
Mm-hmm. Yeah, please don't leave until you've given us a little bit of feedback there. It won't take but a few seconds.
We really appreciate it. As you're doing that, I'm going to move us to our next slide, which is all about ways to influence the policymaking process. The last question that we're going to ask you is how likely you are to use this information to influence the policymaking process. Here's another list of ways to do that. We're going to throw that poll as well.
Greg talked a lot about these earlier as well.
That's right. Alana, have we thrown that poll too? There we go. Thank you guys so much. And then we're also going to be, oh, I'm sorry, Arm, go ahead.
Sister Sally, I see a remark from you. Thanks for your comment. She said excellent and timely. So thanks all for your feedback in the chat too.
Thank you. Thank you so much, everyone. All right, we're going to be sending you a survey via email as well. We appreciate all your responses and our ability to make these better for you all. All the information that you could need about today's event and our speakers is on our website here. And we hope you have an excellent rest of your day. We'll see you next time. Bye all.
Bye.